Thank you, panelists. And now questions from the committee. Dr.
Yes,
Burehouse?
Peter Burehouse. This is a question for Bernadette. You were talking about the return on investment, and I'm sure that would get the attention of many in the C-suite. Are there other strategies, though, that you found to be effective to moving people further along in this and that beyond just the economic returns?
Certainly, quality and safety. So again, linking clinician well-being to those outcomes are super important. But I will tell you, because I get a lot of calls from people across the United States asking what I do as CWO. I share our experience at Ohio State and our tactics, but I want to add, it truly is the ROI that gets the C-suite to move on this, to invest more money. But we've gone from ROI to VOI, value of the investment, that goes on beyond just dollars. Lastly, nursing is missing an opportunity to lead population health and well-being. If you look at who's moving in to all these CWO positions, it's physicians. We've got to step up. This is in our roots back to Florence. So I want to see more nurses entering CWO positions because there's going to be a lot more of them.
So I'm Maureen Bizignano, and thank you all. It was a fantastic panel. I'm wondering if you could speak to two things about nurse well-being. One is, I hear the challenge, but I'm wondering if, linking to our prior panels, do we understand the social determinants of health for nurses? Do we understand what they're living with enough to support them structurally? And then secondly, I think really to think about how can we create a profession that models health in every way, physical health, mental health, resilience, because as we've all said, you can't give what you don't have, and I think that modeling really might be an important aspect, so I'd love you to speak to that.
Quickly, there was a study that came out that showed physicians who engaged in healthy lifestyle behaviors themselves were more likely to counsel patients on that. I didn't present the data on the nurse healthy behaviors in our study. We're writing that up now for publication, but it was pretty disheartening. It really was. So again, leaders, nurses, physicians, we all have to model those behaviors to rub off on our patients.
And to add to that, I'm thinking of the magnet system in nursing in the US. You know, magnets are designed to draw other nurses to come and work in this health system. And can we do a better job within Magnet to prioritize well-being of nurses? This is a place where I am fit. There's a gym near the hospital campus and not 2 miles down the road. Here's a chance for me to move to stand to sit. Let's draw nurses that way. Takes us back to return on investment. I mean, it's costing over $80,000 to replace a nurse per year. So let's keep nurses that way by building systems like that are focused on the individual. We're so afraid of being selfish, but maybe we need to be a little more selfish because patients see that and say, oh yeah, you're a human too.
I would just say, Maureen, your question is a statement in itself. I'm not even sure we really need to answer it. I think the reality is when you begin to look at our workforce today, so I'm an old HR guy as well, when we look at a nurse that comes in who is on her second hospital of the day that she's practicing or that she worked in the community health center because she's got 2 kids at home to feed and she's trying to figure out how to do her shifts and get home in time to feed her children so that she can get 3 hours of sleep and show up for her next shift, we have something fundamentally wrong with the system. And so we have to look at that. See, that again, to me, a conversation on the future of nursing around just the tactics and wellness don't get us there. So if we don't fundamentally change the system by which we actually draw our employees and build a structure for them to be healthy and vibrant themselves, and it's not just about wellness practice, it's about the system that ensures they can come and do a job well and support their family well. I mean, I think it was so aptly said by Dean Beard earlier on. We have to address that as well.
Time for one more question? No? Okay. Do I see a question being negotiated? Okay, it's time to wrap up. I understand that, sir. Okay, thank you, panelists, very much. And Dr. Hasmiller?
Okay, thank you, panelists, very much. I just want to remind everyone that the town hall meetings, the purpose of the town hall meetings are really to inform the committee members. But in that, I hope that everyone learned, they were inspired, and you were really moved to action. I know I was. So thank you to all the panelists.